comfortable to discuss with others, even with the doctors. So even though we are serving for teenagers, adolescents, but my school is a little kind of wider in adults as the whole population too. So with experience, my experience, I had a Burmese family who needs to have a physical exam, who was the mother of 3. When we went to the doctor's office, of course in Burma and other countries, maybe they don't usually have a yearly checkup or dental cleaning, that kind of stuff. So she was about to go into the room for the checkup thing. She was very adamant. She didn't want to go. So that was a big struggle. So no, this is not to harm you. Even though she has 3 kids already, she never had that kind of college exam or pap smear. So it's very important to educate our clients who are if they come from other respective countries or culture, all those health regarding things. So eventually we had a little talk and counseling session, whatever you may call it, 10 minutes, and it's important to the provider, the care provider was male too, and everybody coming from Asia, and then African American male is going to examine. So that was a big thing. So eventually after 15 minutes, so she is back. So what I would like to mention is that just to be aware of that in this country, maybe we can take for granted. We may not be able to wear it unless we have experience, or through the clients, and we may not even notice that kind of stuff. So it's important if we have clients who are from other countries, not native U.S. born, is important to ask them question and what male doctors or female doctors, something like that is important. Even our male, right now, adolescents, residents also, due to their religious backgrounds or the culture or whatever. So some of them request even for the psychiatrist evaluation, not only the help regarding, I think they requested, and even interpreter too, male, female, something like that. So just to be aware of that as social workers. So some refugees used to self-medicate, and in the interest of thrift, this may be a problem when it comes following a course of medication in this country, because the doctor would provide them for infection or certain thing, and then they have to take, even though they may take after 2 pills or after 2 days, they may feel better. Oh, I don't need to take anymore. So it's important to be able to finish on the course that the doctor provides them. So, the next slide. So these are the pictures, the coining. I don't know, are you familiar with the coining therapy? This is the coining. They rub when the person is sick or headache, nauseated, stomach ache, and then they have self-medicate by using the coin or any sharp object, and then also they use any kinds of oil. Any kinds of oil, like eucalyptus oil, tiger balm, then they rub a little bit on their neck, their back, their ribs, and then with coin they rub it. So then the mark become like that. Their belief is that by doing that, all the heat from the bodies are up, release. Then no more fever. They really believe that it happened too. I have done once too. But I don't do anymore. So we also have, because in this country it can be not acceptable, not appropriate, and especially if you do other hickey or what.
We had several years ago we had a group. How many here work in a residential home? Right. So imagine this scenario. We had these group of youth, and we had, I think it was a few of them had a cold, and so they're maybe home from school. I may be off by a couple details here, and we're in the living room area, and if my memory serves me right, it was one of the youth either had, I think it was the bottom of the pop cans took from the recycling and went over to the oven and was heating them up, and we're standing there. What is he doing? Wait, you can't do that. As the other youth was coming out of his bedroom with his shirt off, and the youth started walking towards him with this, and we had to quickly, again, assess safety first. We had to quickly stop this. There's gonna be licensing violations. We're gonna get in all sorts of trouble. But again, with thinking, is this a cultural issue? Is this kid about to harm this youth, or is there something cultural going on? So obviously we can't say, oh, it's just a cultural issue, they can go ahead and they can do that. We had to investigate further what was going on, and what they were going to do is I'm gonna help him with his cold. I'm gonna help him get over getting sick. Now luckily in that situation, we used the cultural humility approach, and then we used open communication. What we decided to do was have a little house meeting, and we gathered everyone up, and we said, so we recognize and we respect that this is a cultural belief of yours, and that this is something you would do in home country. You just can't do it while we're here. This is for us. This would be a safety issue, and this is against the rules of the home. So we hope you can respect that. We respect that part of your culture. We hope you can respect that's just the rules within here. And here's some alternatives instead. And they were very receptive to that, and we didn't have any issues after that. And I remember being kind of nervous about how are they going to take this. We're trying. This is a part of their beliefs, but the open communication worked really well, and we were able to avoid anything further. That was a situation where we have to say safety first, and that has to trump things.
Right. Like Lucas said, that one resident, Burmese resident, went to at that time junior high school. So then they did on the neck too. So the teacher asked him, what happened to your neck? Not being able to speak English well too. I was sick. I was sick. Sick and what? What happened? What's related to this? And then they sent us home, and then they called us unit, and so it can be CPE. Child Protective Service, CPS. Oh my God, what is going on? And then we are providers, and then guardians, and then so at that time, me as a program therapist, and then coming from the same country, so I was able to explain to the teacher, this is what happened, the same as the clients as well. Lucas said that, yes, this is what you believe, yes, but in this country, this. So we also have in the class, cultural orientation class for our residents as well. In Wedgwood, I don't know, you have class on cultural orientation or not. That was helpful for them not to forsake or not to say goodbye to their beliefs and their value and their culture. Yeah, what is appropriate and what is not appropriate in this country. So those are the component of the treatment too. Yes, they came with trauma, but not only the trauma, I think the other cultural component is a big part too. One more. So this is the coining therapy. They still believe it. And this is the effect of chewing betel nuts. So women chew, and then like a lipstick all red, and decay their gums and their teeth, and so it's very typical since it is not only the Burma, Southeast Asia, India. In fact, traditionally that came from India. Oh yes.
So what's the benefit from chewing betel nuts?
Like a comfort. Like eating chips or something. And for their belief is that to freshening their mouth. like chewing gum. So they may, all of them don't know the effect of the health. Traditional medicine, we talked about already, massage and herbal medicine, some roots from the tree or although they grind, and then for the stomach ache or they have a lot of herbal medicine practice. And next slide. Family life and gender role. Family life is very important in Burmese culture. When we talk about Burmese, all the ethnic, minor ethnic group as well. So uncles, aunts, cousins, they all live together in the same house, and males have priority. Male father and sons are the first priority. So if they have daughter, 5 daughters also, they consider like a Chinese, oh, this woman, the mother is not worth or something like that. So, but not all of them still believe that son and fathers, males are important. Female have many rights as well, including inheritance rights. This is real Burmese, but not in other different tribes, Chin, Kachin necessarily. So even in the same country, the culture is different as well. So one area of gender distinction is in religious practice too. Female are not allowed to enter some parts of monasteries and not to climb up on the higher level of pagodas, not only the pagodas, even at home or any area. So no luck. That's how they believe. So men should be top all the time. So female should be the lower part. Even though when they wash clothes and laundry, they do not mix together men's clothes and women's clothes, especially women's, the top part jacket, they can mix, but not the skirt. Or, that lower part cannot be mixed with men's shirt or stuff like that. That means no luck. No, that's how they believe. Community values, they respect for elders, people who are older than us, even though 1 year or 2 years older, they respect. And in English, I and you. It's easy. You is for everyone. People who are older, younger, or priest, anybody, and you. Yeah, but in Burmese language, we are like 10 different you. And I too. When to talk to older people, kind of thing, and there are many languages. They are responsible for their parents, older parents, grandparents, but in this country, individual, they go to the nursery or retirement home, but in Burmese culture, they are considered they have duty to respond back. Cheerful humility are important in Burmese culture. Adultery is considered taboo, an unnatural act that can bring catastrophe on the whole village, like earthquake or thunderstorm or something like that. Relationship very hospitable, will expect any guest to eat with them, even though they might be eating a cookie. Here, have something like that they always offer. Polite greetings, holding your right arm, elbow into your, they hold, when they shake their hands, in America, like this, right, or Western, but they hold their hand with the other left hand, they hold their elbow, that means very respect. So, shoes not worn in home, no luck, so they have to put at the entrance of the, that is not just Buddhist culture, I think it's Asian. Yes.
So in a situation where somebody, like eating, and they expect guests to eat with them, so they offer,
Oh, yes.
is it okay to decline, or is it best to accept?
It is a good question. It is okay to decline. I have already, thank you for offering or something like that. So, but that's their culture and hospitality. And Yeah, for example, if I eat and then somebody, if I don't offer, then somebody might be drooling, whatever, who knows. Then their belief is that, okay, if you don't offer the other person, then you will have a stomach ache. That kind of belief they have. So if they decline, that's fine, but I have to offer. I still have that habit a little bit, so yeah. Art and crafts, Burmese is known for traditional arts, including gold, silver, carving, wood carving, very attractive to tourists from Western. Literacy and education, approximately 68% are literate, 37% in 1940. Housing, refugee, young children, this is not just refugee, generally speaking, the Burmese culture, young children often sleep in the same room as their parents live, even on the same bed. Treat older people, Buddhist monks, Buddhist images and objects with respect. Lower head a little if you have to pass close in front of older people. You don't walk like this, so that you just have to bow down your head. That means respectful way. Don't point your feet toward a senior person and teachers. The feet are regarded as the least noble of the body part, and it is disrespectful to point them to others, and then not to touch people on the head. So my husband sometimes, jokingly touch my hair, and then, oh no, don't touch my hair, so, because this is the top of the body, so it's considered the highest, and so they don't usually touch the head, full hair or something like that. Try not to show anger at Burmese people versus in Western culture. I mean, we are very much assertive, right, frank, and which is good too. Their part also need to learn. We have been educating our residents as well. It's important for them to know. But showing anger and fronting in front of Burmese people are very bad, and losing the temper and that kind of manner can be poor upbringing. Oh, okay, maybe his or her parents did not teach, or grandparents did not teach them something like that. They have assumption, and so such behavior is not easily forgiven. Speaking of that, so we have experienced the voice is so sensitive working at the residential units. I think not only our residents, I think the staff needs to be oriented and educated as well. For example, we have different refugees, not only from Asia, all over. Some residents are very sensitive where they come from and the culture, the parents, and then they have never heard about raising their voices. So sometimes when they heard from the staff raising voices, meaning, oh, they just met like 1 week, they don't talk. So I think I experienced that too, especially when people don't speak English, and some people try to raise their voice, which is not necessarily or louder. That doesn't help them. So they are not deaf, and their problem is not being able to understand English. So just to speak slower and repeat those may be helpful. So not necessarily always behavior problem. That's just a little thing, raising voice and that kind of stuff really make them mad, and looking at a speaker when we talk and then eye to eye is very respectful in this country. Is expected, but for Burmese culture and some Asian cultures, it's so rude and it's challenging. If we talk to our teacher or boss, and when we talk, if we look at eyes, oh, she is challenging me. So then if you have seen some Asian clients right now or in the future, so they just to have, to acknowledge about that. That doesn't mean that they don't respect you. They might look down the carpet and look down. So the same thing, it is important for us to educate them as well. Like they go to the immigration interview and stuff like that, it's important to look at your face. Both ways, the trauma, Lucas talked about that. This is the trauma training, so we have a lot of things, the whole session we can talk about the trauma things. So the study found that most common trauma event experienced by the refugees are the following: forced labor due to their country's government, because especially in Burma, there's a military regime, was there for like 50-something years, so depressed, and forced labors, missing and lost family, raping, death of family and friend, mother or family or friends. Due to, oh, that's okay, no, you can go. The study also showed that there are two basic types of traumatic experiences in children. I said children, adolescents that we're serving. Type 1 is called event stressor, refer to childhood trauma usually characterized by a single, sudden and unexpected exposure to an overwhelming stressor, like death or sudden accident or something like that. Type 2 is process stressor, result from prolonged and sustained exposure to repeated stressor, psychological sexual abuse, so it's ongoing thing. So because of all this trauma, the effect can be seen like sleeping problem, insomnia, you can be substance abuse in order to cope all those stress, so they keep drinking alcohol and using marijuana, cocaine. So Lucas had mentioned already, adolescents' brain and bodies are very involved in developmental and emotion, the way of their thinking, cognitive processing, they are related. For example, the child who grew up in the home, if she or he had a lot of trauma, abandoned him, or abusing him physically, emotionally, developmentally, those child who went through the traumatic event, the developmentally, physical and psychological connected to the brain, that can be seen, their heart rate become faster, the blood pressures are higher, so it's related. Hypervigil, physical tension, all those behavior, we can see that too. Limitations, what usually require mental services are still confronted with numerous challenges, including interpreters, not being able to find the right interpreters, and then not professionally. Sometimes when we are still facing them, having a professional interpreters for mental health. It's very important to have a good assessment accurately so that we can have good diagnosis and then have a treatment effectively. But the interpreters are here to interpret, but if we are not trained professionally, then that is what makes the whole thing problem, because they have side conversation with the clients, what to say, not to say, and without interpreting what the provider has said. And I don't know, how many of you are working with the interpreters? Oh, okay, not much, right? Yeah. So it's very important to have a good, solid interpreters, and then not to have a misdiagnosis. And cultural sensitive intervention as well for not only for therapists or providers, I think, including the interpreters also needs to know the cultural sensitive. Knowing versus learning. When it comes to culture, we should be learners, not knowers. Never guess what is beneath the surface. Dig deeper and ask questions to fully understand the person's point of view. And the last, cross-cultural communication strategy is very important to be flexible, to be accessible too. No, even though we can, I can share my experience, I can disclose, and then of course, we have a 13 residents. We have 15 beds, especially when we have a full bed. It's very difficult to schedule individual therapy session weekly and group and with interpreters. And so, but sometimes they're sick or they're grouchy, whatever reason. I think it's very important as a care provider to be flexible, accessible. They're teenagers, of course, like from all over the world. And recognize the complexity of communication, recognize and respect differences, and to be honest, ask questions, and think twice, distinguish perspectives, avoid stereotyping, and build self-awareness, listen actively instead of, I think it is very important, my professor at Princeton told me that listening attentively and actively to the client is 100% successful in the counseling, which is really, really true. I think I experienced that too. And instead of saying, but without processing, we really is very important, attentive, and then reflective listening is very important. And so they feel that even though they are, teenagers and coming from even no education, but they are so smart. I mean, the person is paying attention to me or just to be responsible, just doing or not, they really feel it more than we can describe. So to be authentic and accessible and honest, those are very important, and then they can feel it, and then you can see the rewarding too, even though sometimes maybe baby steps, but I think I experienced, I've been there for 7 years, so through this treatment, sometimes it can be disappointing, and then we don't see the harvest, the fruit right away. But sometime after they left from the program, and then you see after 1 year, wow, that's really wonderful, regardless of all the challenges that we went through. When you see the fruit, oh yeah, that's the best. And then rewarding, at least no matter what, God is the one who is in control, who makes heaven and earth. So at least we can plant the seed, so God will do the best. Thank you all. Thank
Do you guys want to keep going, or do you want to take a short break? How about we'll keep going, and then if anyone needs to get up and use the restroom, please feel free to do so. Did you want me to do this? Yes, go ahead. Okay. Grab some water here. Okay, my name is Nathan. Simplest name. Because my father started working in the bank in the month of May. Nathan. I come from a country called Zambia in Africa. This is more inclined to the south. So some people refer to it as central, but it's more inclined to the south. So geographically it's supposed to be a South African country, or in the region of South. I've worked in different programs, different projects under the auspices of the United Nations, High Commissioner for Refugees in Africa. I know it's very difficult to speak with authority over a region as big as Africa. The only claim I make this morning is that I've traveled to 22 countries, almost half the countries of Africa. I started doing this at a very young age, helping the youth in exile. There was a project called Youth in Exile. And so I've stayed in countries in West Africa, Central Africa, East Africa, South Africa, and traveled some countries in Europe, Canada,
I had never been to the US before. So I came here 15 years ago. I can understand 12 languages and speak 8.
Wow.
Don't ask me to greet you in all those languages. It will take the whole session. In the US,